I do have one question because I think it will come up for marketers eventually as we think about expansion of virtual care over time. Is any concern from consumers about, does the quality of my care diminish in any way because now I'm primarily, talking to my physician in certain circumstances via video or virtually. Any advice on how to address that? Are you seeing that already as a concern at all?
Yeah, I think we do hear it as a concern from people. We hear it as a concern internally from our own providers, right? I think the answer lies in the fact that it's not trying to compare itself to and compete to. It's trying to be different then, right? There's different functionality that you can do on a video visit tool than you can do in an in-person office in there. And so think about this, right? Think about the potential scenario where you have some sort of an outbreak in the community where people have something that's very contagious through their coughing and through their breathing, right? That's our COVID scenario, right? And the ability to create a connection with that person in their home, talk to them, create a conversation and create a plan with them in their home is actually, from a quality perspective, in some ways significantly better than having them come down to my office and walk into my office and sit in a waiting room, right? And then come into the office and see me. There's scenarios where the telemedicine visit is superior from a quality perspective than what we do in person. There's a lot of vice versa too. There's a lot of scenarios where in person does things and things can happen in there that we just can't do on a telemedicine visit. So I think the key is that they're different tools for different applications. And to be able to, we talked all the time as we first started doing this, to be able to triage people and be able to provide care for them at home exactly in this scenario of coronavirus was a wonderful thing to be able to do, not just from a convenience perspective, but from a safety perspective, right? You kept those people in their homes. They weren't sitting in a waiting room. That person could have had coronavirus, or it could be the opposite. That person could have not had coronavirus and they could have sat in the waiting room with two other people who did have coronavirus, right? So as we went through this was a great way to get care at the right place at the right time to those people. But it isn't always the answer. There are times when it isn't the place to give people care at the right place and right time. And that's where sometimes we clearly have things where we have some protocol set up where we'll say to somebody, you know what? Doing this over video or doing this asynchronously isn't the right application for you. We can get you connected though. And that's where, we talk about sort of a whole suite of services or what a healthcare system can do in this. And the advantage a healthcare system can do is we can say, we can connect you with somebody, and we have people right in Oak Park who might be able to connect with you, and we can get you in there this afternoon or tomorrow or something like that, right? We have an opportunity to do that with a whole continuum of services that can make sure it's what's the right tool at the right time for the right situation.
Well, that's good to know, because as allergy season rages.
That's right. Yeah.
I am not interested in sitting in anybody's waiting room. I already told my primary care provider, this is how we're going to be doing it.
That's
unless
right.
we have to do it otherwise. So thank you so much for your time.
Yeah.
Thank you for sharing your insight. And thank you for being a leader in this market, especially in a hotspot like Chicago.
Yeah, it's a pleasure. And thank you both for your engagement on this topic and for the work that you guys do. I really think you're in a spot where that intersection between the consumer and healthcare is just a really interesting spot there, where there's so much that we on the healthcare side can do to really make sure that we create really good connections with people that really work for them in ways. And technology is just one of the big ways where we can get a lot better. And we have gotten a lot better very fast.
Absolutely. Thank you.